You've probably heard that cracking your knuckles causes arthritis, but that's one of the most persistent medical myths out there. The truth is, cracking your knuckles isn't harmful, and science has proved it. The popping sound doesn't come from bones grinding or joints wearing down. It comes from gas bubbles rapidly collapsing in the fluid that lubricates your joints. Inside each joint is a substance called synovial fluid, which helps reduce friction when you move. When you pull or bend your finger to crack it, you create negative pressure in the joint. That causes dissolved gases, mostly nitrogen, to form a bubble, which then quickly collapses, making that sharp, satisfying pop. It's basically joint physics. Multiple studies, including one by a doctor who cracked the knuckles on only one hand for over 60 years, found no increased risk of arthritis. MRIs even show that joint structure remains normal after years of regular cracking. That said, cracking can sometimes indicate joint hypermobility, and overdoing it might irritate tendons or surrounding tissue if you're forcing movement. But for most people, it's harmless, and for some, it may even provide temporary relief from joint pressure. Still, the reason we've believed the myth for so long comes down to confirmation bias. People associate aging relatives with arthritis and knuckle cracking, but those two things aren't causally linked. In fact, arthritis is more closely tied to genetics, repetitive joint stress, injury, or autoimmune conditions, not cracking your fingers. So the next time someone scolds you for that satisfying snap, you can kindly let them know it's just air bubbles and science is on your side. Subscribe to Fact Flash for more myths busted by real data.